Hi, it's Paul Slakis, Good News Planet. We're going to talk about a very important subject here, the importance of flu testing, how to treat it. We're talking to Dr. Douglas L. Ambler. Good morning, doctor. How are you?
Good. How are you?
Okay. You're an internal medicine physician at Northwestern Medicine Central DuPage Hospital and medical director of quality for Northwestern Medical Regional Medical Group. Wow. We also have Dr. Norman Moore. Hi, Dr. Moore. How are you?
Doing very well, thank you.
Great. Director of Scientific Affairs for Infectious Diseases with Abbott Rapid Diagnostics. Abbott is a great company, does an immense amount of research development and with much success. So this is really a big honor to get to speak for somebody with that great company. So, plus, this is extremely important, flu testing. Maybe, I don't know, who to Dr. Ambler, would you like to start first?
Yeah, sure. First thing I would like to point out is that oftentimes this time of year when we're talking about flu, just to differentiate stomach flu versus true influenza flu. So when we're talking about influenza, we're really talking about an upper respiratory infection, so fever, cough, body aches, whereas when we're talking about stomach flu, then we're talking about nausea, vomiting, diarrhea. So true influenza is a thing that we can then test for by doing these different tests that Abbott have developed, whereas stomach flu is something entirely different. And when we give a flu shot, that's protecting against influenza, but that does not protect against the stomach flu.
Okay. All righty. Well, actually, what actually is the difference? Dr. Moore, maybe you could share. What is the stomach flu?
Just about that stomach flu. Quite often it's actually caused by eating contaminated food. So maybe if somebody's not washing their hands appropriately and they have that food, again, the best thing you can do at that point is stay home, stay hydrated. But if you're throwing up and have diarrhea, that tends to be more of that stomach flu, again, rather than the influenza that we're so concerned about and really has that higher mortality. Again, last year alone, influenza had about 80,000 deaths here in the United States, so it was quite significant last year, which, again, brings up the importance of vaccines and testing.
Why do they just, if you don't mind, either doctor, why do they both call them both flu? And what is flu? What does flu stand for? FLU, those three letters.
Flu is basically short for influenza, so it doesn't stand for anything in particular besides just an abbreviation. It kind of got into the common lexicon, and it's kind of unfortunate because it's the common lexicon, people just assume it's the same thing. Again, it's caused by two entirely different viruses. One attacks our respiratory system, one attacks our digestive system. So we have that name, but they have, besides that, nothing in common.
The nerve. Like, we should change that. Well, it's complicated enough. It's complicated because everybody wants to know, do I have a cold or do I have a flu? So why don't we talk about that? Right? You go to the doctor because you're questioning whether you have the flu, because the flu is a serious concern, right? Maybe Dr. Ambler, what's the difference between a cold and a flu?
Yeah, that's a great question because that is, it can be difficult even for your, local physician that you see. So typically influenza is going to come on more quickly and abruptly, and it's going to be much more severe. Typically you can easily get fevers of 101 to 103. The common cold is typically more runny nose, usually slower onset. Typically you don't feel quite as sick. Influenza can definitely get down into the chest and cause cough and pneumonia. And so between the two, influenza is certainly much more severe. And as a result, especially for our patients that are at greater risk, or younger patients, older patients, pregnant patients, immunosuppressed patients, we want to get those patients in as soon as possible and get them tested and then treated, because we do have a 48-hour window at which time we can use antiviral medicine only for influenza. We don't have antiviral medicine for the common cold.
I've had a cold for too long right now. and I'm coughing for too long right now. Can my cold become the flu?
No. But go ahead, Doctor.
Did you say no?
Sorry about that. Typically, when symptoms are rather mild and go on for a week or two, oftentimes those are going to be just common cold symptoms. Influenza, you'll typically get that high fever in bed with all the body aches that you'll have. So influenza, I would look at it as much more severe form of a common cold.
Okay, so now let's talk about the flu, because I guess Abbott has created with the research, and has just been around for a while, something to help to find out whether you have the flu in minutes. Am I reading this right?
That's pretty much it. Quite often, they had a lot of rapid tests that were pretty specific but not overly sensitive, and if you wanted those more sensitive tests, it got sent to the laboratory, and it just took too long to really help with the prescribing habits. So they have a new test called ID Now that has those lab-based results in minutes, so it can be brought right to the patient. So whether they're at their primary care physician or an urgent care clinic, you can get those results and, again, be treated far more accurately than before.
Okay, and so how's that administered?
Basically, it's a swab up the nose. So it's something as simple as that. So it's not overly invasive. There's not any blood. A swab goes up the nose. That sample goes into the device, and the positive results start coming out in 4 to 5 minutes. So pretty accurate, pretty quick.
So this is major, right? I mean, worldwide. The flu is not just within the borders of America, right?
It is a very exciting time to actually there's so many people that demand that antibiotic, and when you know it's influenza, you know that an antibiotic is not going to do you any good whatsoever. So, again, you take that right viral medication, and it's better for everybody.
Yeah, that is really, really special. And sounds to me like, can you screw up taking the test? Can you put it in the wrong nose? Does it have to be in the left side or the right side? Does it matter? The nostril? Does it matter?
I don't know what the we know ambidextrous means two hands. Ambi knows. I don't know if there's such a thing. So as long as it's up a nostril, we're good to go.
Either one. And how far? Sometimes these. I hope you don't mind. I ask a lot of times very simple, very maybe naive questions. But sometimes those have, in all my 20 years of interviewing people, those have always been the ones that I say, that's the one we should be asking. How far do you go into the nose? Is it a little, halfway in? I don't know. How do you take this swab and put it in?
Actually, it's a wonderful question. It's a great question. People sometimes mess it up. You don't want to go around the outer ears, just rim the outer nose. You actually want to go up to the turbinate where there's like a little bit of resistance. So going up that far is really where the virus lives. So you go up that far and you get better results.
Okay. This is really very, very interesting. And you can tell so quickly. So a general doctor, a general practitioner, the 6 that are left, right? They can administer that now with the changing in the scene of medicine, with these urgent care places, with CVS being bought by Aetna, and so will they be doing this in others, Walgreens, Duane Reade, blah, blah, blah. The changing medical scene here in America, the pharmaceutical place, you can get peanut butter and jelly and get a prescription and a shot at the same place. How will that affect it? Will they be doing this in pharmacies in your local drugstore? Or are they already?
They certainly can. They certainly can. That's one of the things is people want convenience, and they're going to places that are more convenient for them. So if the tests don't follow the patient to where they go, they're not going to get the right diagnosis. And again, they may get unnecessary antibiotics.
Yeah, and that's a serious thing because antibiotics, you don't want to get them too often, do you?
Oh, absolutely not. That's one of the main things right now. The great threats to humankind is these antibiotic-resistant bacteria that are really a major, major threat.
How successful is this year's flu shots? And you take 2 of them. Now you got to remember, they're 6 months later, right? How successful is this strain that they're out with now?
you want to handle that, Dr. Ambler?
Yes, I'm sorry.
Yeah, sure.
I don't know who they are.
It's early. That's quite all right. It's early in the flu season, so it's hard to truly predict how accurate the vaccine is going to be. So we know from last year, from looking back, the vaccine was roughly 40% effective. And so you can calculate that later in the year. We do know the current flu strain and our flu vaccine does have some overlap, so it looks like we're going to be on a good pathway for this year, but it's quite honestly just a little bit too soon to tell. Plus, the virus can always mutate along the flu season, so then the vaccine, which maybe was effective, could be rendered less effective later on in the flu season.
Okay. There's a lot of good information and very important. Let's see, just two last quick questions, because I know you have to speak with a lot of people, and I think that's great. First of all, where do people go for more information about this? Or, well, let me ask you before. Is there something else you want to say to the audience before I ask you the websites?
I would just say it's just real important for especially our patients that are high risk, the ones we had mentioned, like our pregnant patients, younger, older patients, immunocompromised, heart, lung disease, cancer patients, that those patients really do get seen as soon as possible to really be by their primary care doctors to really see, do they need to be treated? Would they benefit from treatment? So just to put the word out for those patients that they think they might have a cold, but if it's really more severe than their typical cold, those are the patients we really do want to have seen within that 48-hour window, because those are the patients we can treat.
And what's it called again? The test by Abbott, and once again, it's a very socially minded addition company, very corporate, a lot of corporate responsibility. What's the name of the test? I think you mentioned something.
It's called ID Now. Again, by
ID
Abbott.
Now.
And if you want more information, the big place to go, the www.cdc, the Center for Disease Control really tries to update their website as often as possible with the latest information where flu is in your area or there's any other things happening with influenza. And if you want to know more about the test, to talk to your doctor, that would be www.abbott.com. Okay,
last question. We're very involved with the International Day of Peace. Health is peace, big time, right? Especially when people are dying from health concerns. If you guys don't mind, I would like to ask you, what does peace mean to each one of you guys, if that would be okay? Maybe Dr. Ambler, if you would start.
Well, I think, this time of year and Christmas and holidays for everyone. I mean, from my standpoint, just spending a lot of time with family, having my daughter back from school, and then just giving in terms of to others through my, my profession, but in terms of just my own family, that's what kind of comes to mind, especially this time of year.
Okay, great. And thank you both for being doctors. We really need doctors, and we need more doctors. Dr. Moore, what does peace mean to you?
What it means to me, I've had the benefit of doing a lot of travel, both national and international, in my career, and I see a version of the golden rule everywhere I go. And so I guess basically following that golden rule for everybody works well for both peace and love.
All right, beautiful. I love it. All right, guys, thank you very much for coming out about this very important invention, let's call it. Thank you. Thank you.